Well, staying on the theme of healthcare, I wonder whether you're one of the hundreds of thousands of Australians who suffer from chronic fatigue syndrome, or do you know someone who does? An international research conference is being held in Melbourne this week, and it's going to shed new light on the latest medical research, with chronic fatigue syndrome being something where there's no diagnostic test. There's no, clear treatment guidelines because they're contested, and there's also no cure. Joining me in the studio is Dr. Heidi Nicholl, who's the CEO of Emerge Australia, which is the peak advocacy group for chronic fatigue syndrome. Dr. Nicholl, welcome.
Thank you.
And also Paul Fisher from La Trobe University, who's going to deliver a keynote paper at this week's symposium. Dr. Fisher, good morning.
Thank you.
So let's start with a basic definition, I guess. Heidi, can you tell us what exactly is chronic fatigue syndrome?
Okay, so chronic fatigue syndrome, also known as myalgic encephalomyelitis.
So they're the same thing?
It's pretty much the same thing. There is some debate about that. We represent people who identify as having either ME or CFS. So we usually refer to what we're talking about as ME-CFS, which is chronic fatigue syndrome or myalgic encephalomyelitis. Mm-hmm. And what it is it's a complex chronic health condition. It affects about 1% of the population, so that's about 240,000 Australians. And I think the thing that most people are surprised by is that about 25% of people with the condition are so severely unwell that they're actually housebound or bedbound.
So what's actually happening to the body?
Well, we still really don't know, but research in the last 5 years or so has started to make big inroads into understanding what's going on. And basically you end up having a disease where pretty much every system of the body can be affected for reasons that are really not yet clear. We in my lab have found a very specific defect in the energy-producing compartments in cells called mitochondria. They're like tiny little bacterium-sized compartments inside cells that are responsible for making more than 90% of the cell's energy. And there's a defect in that process.
I think you've described it like an engine, not firing on all cylinders?
Yes, that's exactly right. So what seems to be happening with CFS patients or ME-CFS patients is that their cells recognise that they've got a problem making energy, they're doing it inefficiently, and so they try to solve that problem by turning everything up. As a consequence of turning everything up, if they're at rest, they're okay, they can have enough energy to keep going, but they've now got everything turned on full. They're firing on some cylinders, not on all cylinders, and as a consequence of that, they don't have anything left in the tank, so to speak, to turn up their energy production even more if there's additional acute energy demands on the system. So for a patient, that might mean that they can't do even simple household tasks like going to the letterbox or having a shower, because that's an extra demand of energy that they can't meet.
So how many people in that 240,000 who have been diagnosed with this condition, how many would be that bad? How many would be functioning and you may not actually be aware that they suffer from it?
Well, we usually say 25% in that severe category of the housebound or bedbound patient. So that's, if we're looking at 50, 60,000 Australians, and we just think they've disappeared. So this also disproportionately affects women. 80% of people with ME-CFS are women, and they've just disappeared. So we don't see them because they're struggling at home, and they're struggling with all of the symptoms of ME-CFS. So we often think of this as just being tired, but it's not just about being tired. Patients have a whole range of symptoms. So a lot of people will experience pain, they get flu-like symptoms, so they get headaches, sore throat, swollen glands, and at the worst end of the spectrum, people can be very sensitive to noise or light. So obviously that can affect people's daily life in very, very profound ways. But I did want to say, I think relating to what Paul was saying, the central thing with ME-CFS and the way that it is diagnosed is this thing called post-exertional malaise. And what that means is if you use too much energy, if you use more energy than you have left in the tank, you pay back very, very severely. So what that means is all of those symptoms get worse. So if you use more energy than you can be producing, then all of those things, you might get headaches, migraines, joint pain, and it all gets a lot worse.
So you can't do a blood test, it's not really a clear diagnostic test.
So
is that clear? Is that a very definitive?
So we really want a biomedical diagnostic test. There are labs all over the world that are working on this at the moment to get something, because obviously that's what patients want. They want to go to the doctors. They want to have a simple test that's available.
And then they want to be given a magic pill and fix it up.
And then you can get, well, at least you could then get onto treatment pathways. But I would say there's a bit of a misconception that it's impossible to diagnose or really hard to diagnose. There is something called the Canadian consensus criteria. And when you work through these criteria, if you have post-exertional malaise and if you have a set of symptoms that come into these different categories, then people can be pretty sure that the patient does have ME/CFS. But yeah, we need more research to get that blood test.
Well, that was going to be my next question, Paul. Given the number of people who suffer and the number of people who suffer from this significantly, how well researched is it?
It's not well researched enough. We're way short of what we need in terms of understanding what's going on in this really complicated disease. Australia has an abysmal record of funding this over the years. I think the last grant that was given from the NHMRC was 2005, and that wasn't on biomedical aspects. So as a consequence of that, we're only now just beginning to understand what's going on at the cellular and molecular level.
You're listening to Dr. Heidi Nicholl and Dr. Paul Fisher, who is the Professor of Microbiology at La Trobe University, and Heidi is from the peak advocacy body Emerge Australia. I wonder whether or not you suffer from chronic fatigue syndrome and just how debilitating it is and how easy you found, first diagnosis and then, of course, treatment. 1300 222 774 is the number, or you can text 0437 774 774. Once you have been diagnosed, and you talked there, Heidi, about starting treatment paths, how clear are those treatment paths?
So this is something that, again, it's a lottery out there. So we know that GPs are often sympathetic to patients, but the clinical guidelines are super, super out of date. So they were last reviewed in 2002, and really it's the information that is out there for GPs is very poor. So we at Emerge Australia are developing GP education to try and get that a little bit more up to date, but we're really campaigning for the GP guidelines to be updated. The other thing that we're doing at Emerge Australia is we're really pleased to announce that we recently won a grant. We're one of only 10 organisations to get a telehealth nurse to come into our office to be able to work directly with patients. So it's a pilot programme to evaluate how patient organisations can work with nurses.
Can ring in and basically
so
do
they
it.
can ring in and they'll, so we're going to start this in the next couple of months, and it's really part of this programme is to provide good evaluation and good development of those pathways. So we're really nowhere near where we should be in comparison to other diseases, but it is starting to be recognised as a real biomedical illness, and we're starting to get those things in place.
And what is the best way of treating it, Paul? What's the most effective?
The patients tell us that the best way to treat it is with a process called pacing, where each patient, because there's so much variation, each patient knows what their own energy envelope is, so to speak, and they have to be careful not to exceed that. So it's very important that any activities that they do undertake are within that energy envelope, so they don't get this post-exertional malaise or payback that Heidi referred to earlier.
So you're presenting a paper at this conference. How significant are conferences like this? I mean, you talked earlier about the number of international bodies that are actually researching this. So this is obviously, is Australia been a bit slow on the uptake here of treating this as a serious condition?
Australia's been slow, but I have to say it's been slow around the world as well. I can't say that Australia is leading it in terms of recognising it as a biomedical illness and funding that, because the UK and the US have already started to take significant action in terms of funding ME/CFS, and the UK Parliament has recognised it as well. Australia's a bit behind in that April in that way, but Australian researchers nonetheless have been making great contributions to the field on tiny amounts of money, mostly from charitable foundations and patient donations.
Is there any indication that's going to change? Any lump sums coming your way?
It would be lovely if it was. We are hopeful that there will be funding coming the way of ME/CFS research in the next year or so.
And we're encouraging all patients on our website, actually on the Emerge Australia website, we have a front page item about encouraging patients to send letters to their federal MPs. So in this time of electoral change, it's something that we're campaigning very, very fiercely about, to ask for that research money so that patients are recognised for the disease burden that they're enduring every day.
I've got quite a few text messages here. One saying my 20-year-old daughter has had chronic fatigue for 5 years. This topic is way too big to text anything useful. Just so much to say. Frustration. And Michelle says, I've been diagnosed with fibromyalgia and told a symptom of this is chronic fatigue. I struggle every day. And another from Fiona, my son thought he had CFS and was diagnosed 10 years ago, recovered a bit, but was not content, so pushed for more info, and he finished up being diagnosed with Lyme disease and is slowly recovering. Is that one of the problems with this, is that it crosses over into so many other areas because of the range of symptoms?
Yeah, I mean, again, I'd kind of draw back to this Canadian consensus criteria that if doctors are well educated and they know what they're looking for, then the diagnostic criteria for ME/CFS is quite tight and it can be diagnosed accurately. Now, obviously, things like Lyme disease and multi-chemical sensitivity and other chronic complex conditions, they will have their own of symptoms and their own set of diagnoses. But again, that's why we need the funding to get the proper biomedical diagnostic test so that we know which patients we're dealing with and can get them onto relevant treatment pathways.
Bill's joined us from Bairnsdale. Hi, Bill.
Oh, good morning. Yes, my wife's 80 years of age. She's had this disease for some years now. She can sleep up to 15 to 18 hours per day. She has lost all independence, and she is just frustrated now because the doctors here in our area do not have a clue how to treat it. It's just something they say it's permanent, nothing can be done, you'll just have to put up with it. And it's just ruining her life as far as mobility, as far as sitting down, reading or doing something. In 10 minutes she could be dead to the world, sound asleep, and then she'll wake up and do something a little longer. But it is a very frustrating disease, unfortunately. No one seems to know anything about.
Gosh, Bill, that does sound like a dreadful experience. And Paul, that sort of, that just shows how incredibly debilitating it can be.
Yes, it can be life-destroying for patients and also for their carers, because when it's as severe as what we just heard, it has an impact on the whole family.
Mm. And as Heidi said, one of the issues there was treatment options. So an education program even for doctors is part of what you think is important.
Yeah, so we're trying to develop education for doctors, but of course we're also trying to support patients. So we try and have as many resources as we can. Obviously we'll be having the addition of a telehealth nurse, but really it's trying to teach people about pacing and about ways that they can manage the condition. But really, without the biomedical research, without treatments that are going to be effective, we're just not at the moment able to restore people to the quality of life that they had before they contracted the condition.
And just one last question before I let you go. I've got a text message here saying cognitive impairments are by far the worst aspects of having CFS. Many people talk about CFS Alzheimer's. Is this a thing?
So people often refer to brain fog. That tends to be the one that we hear very often. So patients can have real problems concentrating, they can have problems with memory, and this all contributes into this post-exertional malaise. So patients at the severe end of the spectrum, maybe just reading one chapter of a book is going to be too much for them. So that could really even put them into post-exertional malaise because of the mental exertion and the mental effort to try and synthesize that information. So yeah, cognitive impairment is a very real thing that we hear reported from most patients that suffer from ME/CFS.
Well, we wish you all the best for your conference, and may the dollars pour in for more research, because clearly there's a lot of people who are severely affected by this. Dr. Heidi Nicholl and Paul Fisher, thank you very much for joining us.
Thanks, Ali.
Thank you.
Dr. Heidi Nicholl there, the CEO of Emerge Australia, and Paul Fisher, who's Professor of Microbiology at La Trobe University. It's coming up to 22 minutes past 9. Plenty of text messages about chronic fatigue. One saying that CFS has made me bedbound, housebound for decades now, and my daughter has it as well. It's a horrible illness that the government and health professionals have ignored for too long. That's from Jenny in East Melbourne. And clearly now there are steps underway to try and change that, but Gosh, that's a lot of people who are affected, 240,000, 1% of the population. You're listening to Ali Moore on ABC Radio Melbourne, filling in for John Fain.